I think the whole movement in narrative medicine is an effort to bring patient stories, and even clinicians telling their stories, I think, is a humanizing experience. So I'm really happy that journals like JAMA and the New England Journal will have these accounts where doctors show themselves to be human. Sometimes even patients get to write, and they should have more of those. I think there's a recognition among some people in the medical profession that this is needed. Ethics, there's some recognition, but I don't think there's enough about the value of stories and showing people, the professionals, how ethics is experienced by patients and subjects. Well, I think humans love stories. And also, maybe it's a reaction to the more data-driven approaches that medicine is taking. I think it's definitely a reaction to even traditional medicine, where there is this wide distance and this notion of professionalism is so removed. I think maybe it's more. I think in ethics, more of us are aging and having some of these experiences. I know even early on, people like Carol Levine writing about her husband who had serious injury. I mean, people did it, and I'm hoping it's a trend. If you think back to patients' rights in the 70s, that really bubbled up because people were being put on machines and mostly, I think, their families. But even patients themselves, when they were still capable, were just finding themselves in the middle of this kind of a machine. And they sort of, this isn't what I want, and listen to me. And the whole death with dignity, that was a patient, family-driven movement. I actually think that's been an integral part of bioethics from the beginning. And in fact, I think maybe bioethics was more human, more focused on the human and the patient. If you think of the patient as person, is that Paul Ramsey? And a lot of that was, I think, more patient-centered. And then as the field developed, it became more academic. And so I think in the malignant, in the book we talked about how we hope that this is something that will call bioethics back to this approach, this earlier approach, because it's become so professionalized.
So narrative is a means maybe to bring bioethics back to a
Patient-centered, person-centered, subject-centered, yeah.